Good morning, everyone, and welcome to County Executive Pittman's virtual press conference. This morning, the County Executive will share updates on County Council legislation, county's COVID response efforts, and other items. We'll take questions after the updates. As a reminder, please put your name and media affiliation in the chat, and I'll call on folks in that order to ask questions. Additionally, please keep your microphone and camera off unless you're called on to ask a question. With that, Mr. County Executive.
Thank you, Jeff. Thank you, everybody, for joining us this morning. I want to start out with a couple of decisions made by the County Council last night at their meeting. The first is one that I was disappointed by. They had a opportunity to approve a lease with Copper Mine for a tennis center in Millersville, indoor courts that this private partner would have built and then operated. So we would have had for the first time indoor tennis in Arundel County. Most of our neighboring counties have courts, and we have none that are publicly accessible. And it was a controversial project from the beginning. The land had been acquired a long time ago for active recreation under program open space. We're required to do active recreation there. Neighboring residents, as is often the case, were not pleased about the prospect of active recreation and folks from the community coming to that site near where they live. I understood their perspective. I had talked to them. I had been out at the site. But it was fiscally the responsible thing to do to move forward, given the amount of money that the county had put into this. This was a project that was in the county council's capital budget, and it was our duty to move forward, the Rec and Parks Department, and do their due diligence, which they did. So they did an RFP, and they got bids, and they selected Copper Mine as the company to move forward with what would have been the first public-private partnership to build and manage a recreation facility in the county. This is a method of providing high-quality recreation facilities all around the country. Some of our neighboring counties have done it and done it well, and we were looking forward to our first opportunity to do this. We expected there to be support on the council. The council had passed a resolution, 1621, just recently, calling on our administration and county government to do more public-private partnerships. So it was a disappointment that this got voted down 4-3. I want to say to the folks who have been advocating in Anne Arundel County, the tennis advocates, that we feel your pain on this. We still hear you. This will set us back, but we will regroup and make a plan. We'll make a plan for that site. We'll make a plan for tennis. And I just have to say that recreation activities are some of the most important things that local government provides to the residents for the quality of their life. And that means both indoor and outdoor recreation at times. And we will move forward. And I also want to acknowledge the great work that our Director of Rec and Parks, Jessica Lays, did, as well as Erica Matthews, who does our capital projects, answering questions last night and explaining why we are where we are in this process. But I was disappointed with the vote last night. I was pleased, however, with the vote that the council took on a resolution that was introduced by Councilman Volke to redefine what discrimination is in a way that was curious to legal scholars, I'm sure, that was similar to what's being done around the country, using a thing called critical race theory as a opportunity to mobilize folks. I don't understand why anybody thinks that having a critical assessment of things that were done in our past is wrong, and that government should not be facilitating that sort of learning and that sort of studying and working to bring people together. As you know, making Anne Arundel County the best place for all is the slogan that our administration implemented after the number of hate bias incidents were reported in our county that were higher than any other county. And when you drive into our county, you see those signs. And a number of people testified last night against this proposal, this ban on the use of any government funding to treat any group of people different from another group of people in our efforts to provide equity and fairness in our county. It was voted down. I did not expect anybody but the the councilman who introduced it and who was using it on social media to gin up supporters. I didn't expect others to vote in favor of it, but 2 other council members did. But fortunately, 4 did not. And I want to encourage people to listen to the testimony from last night, particularly from 2 people on our staff, Pete Hill, who's our Director of Equity, Diversity, and Inclusion, and Asha Smith, who is our Equal Opportunity and Human Relations Officer. They presented the case against this resolution in a way that was well thought out, both from an educational perspective in terms of from EDI, trying to train staff, train people, educate people to get along better in this day and age, as well as Asha Smith from a legal perspective. And so we will be posting that testimony online and putting it on social media in the hope that it will educate people in our county and bring folks together, everybody. And then finally, we did introduce the supplemental budget request from the Board of Education to address recruitment and retention of bus drivers so that we can get our kids to school and help the companies that that the school district contracts with to meet the terms of their contracts so that all buses can be operating once again. So there is a proposal. It's a place to work from. We will be doing our due diligence. We want to do this in a fiscally responsible way, but we want to make sure that they can recruit and retain drivers for our kids. So that's emergency legislation, and it will be heard, I believe, next month. And then finally, we do have, people may notice that there will be some low-flying helicopters in the county carrying some 20-foot sections of tower. There are, this week, the Solly Public Safety Radio Tower will have work done on it. That'll be mean that Solly Park will be closed on Wednesday. Closed on Thursday of this week. If you notice a low-flying helicopter with some big pieces of tower attached to it, continue on about your day and know that it is something that's planned. The other is Arnold Wells Public Safety Tower in Arnold, and that will be going on Wednesday through Friday. So, and then finally, I want to turn it over to Dr. Kalyanaraman to talk about vaccinations, planning for kids being eligible. We hope will be happening very soon, as well as boosters. But I do want to say that our case rates are dropping, and they're dropping at a good clip. You know, we got up around 20 per 100,000 7-day average daily new cases, and we are down to 13.2 today. If you remember, we implemented a mask mandate in county buildings when the rate got up above 7, which is what the CDC says is substantial spread. So when we get back down to 7, which is where we're headed, the masks can come off for folks who are vaccinated in county buildings, and there will no longer be a recommendation of masks indoors in public facilities by the CDC for people who are vaccinated. So good news on that front, and we will continue to watch those numbers. So I'll pass it on to Dr. Kalyanaraman.
Thank you, County Executive. So indeed, good news. We're seeing our case rate coming down, 13.2. We're seeing our hospitalizations stay in the 40s, whereas just a few weeks ago, they were into the 60s. That's good news. Our deaths are coming down as well. Also good news. So definitely the trends are going in the direction we'd like to see. And that means ultimately people are safer. Great thing we're seeing is a lot of testing is happening too. Please get tested if you have any symptoms. It's good to know, right? There's colds, there's flus, there's COVID. It's good to know what you have because if you do have COVID, you may be eligible for monoclonal antibody treatment. And so it's important to know that. Similarly, if you do test positive for flu, you may be eligible for treatment with an antiviral medication as well. So there are things that we want people to continue to do, and one of them is testing. A lot of talk around boosters. The CDC is meeting tomorrow and Thursday to discuss Moderna and J&J boosters. They'll be discussing how how many months after the last dose of booster should be given, the size of the dose, and we'll also be hearing more about the mix and match booster issue. So should you or could you get a booster that is a different brand than the one of the original set you got? So as soon as we get those official recommendations from the CDC, we'll be ready to provide those, as will others. We have these supplies on hand. Even more buzz around pediatric vaccines and the vaccine, specifically the vaccine for 5 to 11-year-olds. The FDA is meeting next week on whether to approve that vaccine, the Pfizer vaccine for 5 to 11-year-olds. And then the CDC is meeting on November 2nd and 3rd to provide their vaccine recommendations. And that is the step that we have to wait for before we can administer any vaccines. So we've been planning for this for a long time now. There's a number of ways that we're going to make this vaccine accessible to those throughout the county. One, we're partnering with the school system to provide vaccination sites at over 20 elementary schools throughout the county, so that it's easy, accessible for families, and that they can get vaccinated in a familiar and friendly setting. We'll, of course, also provide these vaccines at our regular vaccination sites. And those are the areas that we are going to be administering. Now, we're also partnering with others. We've been partnering with pediatricians for many months now, particularly get the 12 and up kids vaccinated. But all of that work that will be paying off as we do the 5 to 11. A lot of pediatric practices in the county have the capacity to do this vaccination, and we'll be able to provide them back with vaccine, or they can get it through the federal government. Whichever way it happens, we're ready to support them. Similar thing for federally qualified health centers and for pharmacies as well. We're really waiting to hear how they're going to get their supply. If it's not going to come from the federal government, we are ready to transfer doses to those providers, because ultimately we just want to make it readily and easily available for families so that they can get the shot when they want it. At the same time, also want to encourage parents who aren't vaccinated to come get vaccinated with your kids. That's a great way to show them that the shot is important and to protect yourself. And so with that, I will turn it back over to you, Jeff.
All right, our first question is from John from Annapolis. Just as a reminder, if you have questions, please put your name and media affiliation in the chat. I'll be calling on folks in that order. John, you're up.
Thank you. This is for the county executive. Mr. Pittman, do you have an estimate for the amount of time it's going to require to do this due diligence to get this additional money passed out to the school board?
Believe that the council, I mean, we sent it to them as emergency legislation so that we could move quickly on it. I believe they have it scheduled for November, mid-November. I would have to check on the exact date.
So so November, so this is not some types of funding that will be available. I mean, what's your guess that it is to be available getting into the pockets of the bus drivers? December, January?
Yeah, it might be possible to get something moving more quickly, but from the federal money. But for the supplemental budget request, that's a slower process. And yeah, getting it out by the end of the year is I think doable, but not even guaranteed on that front.
All righty, thank you. Hey, can I hop in and get a quick question to Dr. Kalyan Arman, please? Hey there, how are you? I read a report this morning that they're seeing some surges in some of the colder climes of the United States. They mentioned Alaska, North Dakota, South Dakota, Montana, and I think Idaho, citing that because it's getting colder, people are going inside and everything else. Are you concerned, or how concerned are you about another possible surge as we get into colder weather moving in through the fall?
So that's the core concern we have, and that's why we keep pushing on the vaccination. The states that you mentioned have much lower vaccination rates than we do. And that's really going to determine what we see over the coming months as people do go inside, people do gather, and of course we have the holidays. So the best thing that you can do is, if you haven't gotten vaccinated already, get vaccinated. And if you're eligible for a booster shot, get that.
Alrighty, thank you guys.
Thanks, John. Next up, Kate Amara from WBAL.
Hi, thank you. I was writing a follow-up. This is a question for Dr. K on Pfizer shots for little kids, and I know you got one because you said you have. Has the health department supply, not the pediatricians, but your agencies, has your supply of the pediatric doses, do you have it on hand? Has it been pre-positioned ahead of all the CDC and FDA approvals? And if you haven't gotten those pediatric doses already, do you know yet how it's coming to you and when it's coming?
So we are working with the state right now. We do not yet have doses pre-positioned, but we are talking with them about how many doses we're going to get, and they're waiting to hear from the federal government how much the state's going to get. And so we're looking to pre-position that. We expect that to happen. Realistically, a few days before that CDC meeting. We don't really expect it to happen much earlier than that.
And a follow-up, if you don't mind, how many kids do you estimate live in Anne Arundel County who fall into this 5 to 11-year-old bracket? And the reason, I'm sure you know, but the reason the timing is so important is in order for the younger kids to reach full immunity, every day counts, and to do that before the Christmas holidays and traveling and that sort of thing. So I know parents, including myself, are literally checking off how many days do I have. So how do you have an estimate for parents in your county? How many days, how long after the CDC gives its guidance can you open up your clinics and start administering shots to these little kids? A day, a week? Every day matters here. So
yep. So approximately 52,000 5 to 11-year-olds are in Anne Arundel County. When we're looking at the timing of the vaccine and the holidays, it's unlikely there's going to be any kids, or maybe just a handful, who are fully vaccinated prior to Thanksgiving. We are looking to get those kids, as many kids as possible, fully vaccinated prior to the winter holidays, Christmas, New Year's. In terms of when we'd be able to start, our goal is to start within days. A lot of that depends on the pre-positioning of the vaccine, right? From a personnel standpoint, we have the personnel to vaccinate. We just need to have that vaccine in hand to do that. So if we have it pre-positioned, we're ready to start within a day or two of approval.
If no one else has a question, I can just throw this out and get the answer later. You mentioned the 20 schools, elementary schools. Do you know which ones those will be yet? Could you provide a list, or just give us a few of the names of the schools?
No, I don't have the list yet. Everything is still in flux. We're trying to make sure that we have a good mix of geography, Title I schools, community schools. So nothing is firm yet on which schools. But as we get closer to that date, we will certainly be releasing that information along with the school systems.
And your couple of days, the shots in arms, does that include the school sites where you said the health department will be administering the doses? Or
that is the goal. That is the goal.
Thank you so much. You've just made 55,000 parents very, very relieved. Thanks.
Thanks, Kate. Last call for questions here. If you have a question, please put your name and media affiliation in the chat. All right, we'll see you all next week.